Preventing skin breakdown. Use adaptive items such as water or air mattresses, foam mattress pads, chair cushions, gel cushions, heel and elbow protectors. Close daily inspection of skin to detect early redness or discoloration. Prevent friction during lifting and repositioning. Provide good skincare, skin clean and dry, free from moisture, urine, stool, and wound drainage. Minimize skin exposure to moisture, avoid harsh scrubbing or rubbing of skin. Ensure frequent repositioning, if using a wheelchair assist in shifting weight every 15 minutes. Encourage activity. Protect bony areas with soft material, and apply moisturizer to dry skin areas. People at risk for skin breakdown include, but are not limited to, those who use a wheelchair or who are in bed a lot of the time, require assistance when moving, have loss of bowel or bladder control, have poor nutrition and hydration, have problem sensing pain or pressure, have limited ability to communicate, have circulatory problems and/or are older adults or are obese or very thin. Aspiration pneumonia. Aspiration pneumonia is an inflammation of the lungs and airways to the lungs from breathing in foreign material. Aspiration pneumonia develops from inhaling food, vomit, liquids, or saliva into the lungs. This may occur when someone has difficulty swallowing and has watery eyes or coughing while consuming food or fluids. Signs and symptoms of aspiration pneumonia include, but are not limited to, chest pain, cough, fatigue, nausea, fever, shortness of breath, wheezing, and bluish discoloration of the skin caused by lack of oxygen, example, mouth, nail beds, fingertips. Your role if signs or symptoms are noted. Medical staff should be notified immediately and reporting and documentation rules for your program followed. Be sure to report any signs of aspiration pneumonia immediately to your supervisor. Preventing aspiration pneumonia. Correct position while eating and sleeping. Correct diet texture and fluid consistency to meet the person's needs. Good hand washing and respiratory hygiene. Not attempting to assist with meal if sedated. Up-to-date vaccinations and seasonal flu shots, and healthy diet and adequate fluids. People at risk for aspiration pneumonia include, but are not limited to, those who are less alert due to medicines or illnesses, have a disorder of the esophagus, the tube that moves food from the mouth to the stomach, have problems with swallowing, have poor gag reflex, have a gastrostomy tube, G-tube, vomit frequently, are older. Falls. Falls refer to any situation in which someone descends or falls suddenly and involuntarily toward a lower surface or the ground. Fall risk is important to address as 1 in 3 older adults fall daily. Fall complications can include broken bones, head injuries, problem with daily activities, and need for home health care. Factors that contribute to falls include, but are not limited to, health issues and medication, being shoved or running into a barrier, cluttered rooms, area rugs, wet or slick surfaces, improper lighting, wet or slick surfaces without non-skid footwear, and lack of appropriate medical adaptive equipment, inappropriate footwear. Your role if someone falls. Once a fall occurs, don't attempt to move the person until you have assessed him or her to see if there may be a fracture. Call 911 if you suspect injury, continue to monitor, and consult with a physician if the person starts to have frequent falls. No matter how minor the fall may be, remember to document and report all falls as required because signs and symptoms of injury or fracture may not appear immediately. Prevention of falls. Plan space so that it is well lit and without obstacles. Ensure people have appropriate adaptive equipment for mobility and vision, such as grab bars, walking cane, or walker. Make sure that regular medical checkups are scheduled, example, primary care physical, optometrist. Ensure use of non-skid shoes when in the bathroom or other areas where surfaces are slippery. Monitor medications and look for side effects. Provide adequate time for moving from place to place and walk at his or her own pace, and lock wheels on wheelchairs and/or beds when transferring. People at risk for falls include, but are not limited to, those who are older and have loss of muscle, have arthritis, diabetes, and skeletal problems, have visual and/or hearing loss, take medications that cause gait concerns, or do not have appropriate adaptive equipment. Urinary tract infections. A UTI is an infection of the urinary tract, which is the body's system for removing wastes and extra water. Women are more susceptible than men due to their anatomy and reduced bladder function later in life, and symptoms vary by age and gender. There are two different types of UTI. The lower UTI relates to infections that occur in the urethra, a short narrow tube that carries urine from the bladder out of the body and bladder, and the upper UTI is more severe and relates to infections that may involve the kidneys. Lower UTI symptoms include, but are not limited to, pain or burning during urination, increased frequency, urgency of urination, incontinence, lower abdominal, pelvic or rectal pain or pressure, confusion, behavioral changes, increased falls, mild fever or just not feeling well, and changes in urine, such as milky, cloudy, bloody or foul-smelling. Upper UTI symptoms develop rapidly and may not include the symptoms for a lower UTI and require emergency care. Symptoms include, but are not limited to, fairly high fever, higher than 101 F, shaking chills, nausea, vomiting, and flank pain, pain in the back or side, usually only on one side at waist level. Your role if symptoms are noted. People with UTI symptoms should see their healthcare professional as soon as possible or go to an emergency department for an evaluation. You should immediately notify your supervisor and follow your agency's documentation rules. Preventing UTIs. Drink plenty of fluids. Do not postpone urination, urinate when you feel the need. Keep genital areas dry and clean. Change clothes when incontinent. Consider cotton underwear and avoid wearing tight pants. Wipe from front to back to avoid introducing bacteria into the vagina or urethra, and decrease length of time that catheters or tubes are placed in the urethra or bladder, and change on schedule if prolonged use is needed. People at risk for UTIs include, but are not limited to, those who have incontinence of bowel or bladder, limited mobility, extended periods of catheterization, a tube inserted into a person's bladder for urine drainage, a suppressed immune system, or a spinal cord injury or other nerve damage around the bladder that causes the bladder not to completely empty, which allows bacteria to grow. Dehydration. Dehydration occurs when we lose more fluids than we are taking in. The lack of water in the body may result from either a decrease in fluid intake or an increase in fluid loss. 75% of our body weight is water. Water helps transport waste, supports tissue and cell hydration, and helps regulate your temperature. Dehydration can be an important factor in illness and even death. Diarrhea and vomiting are the most common reasons why someone loses excess fluid. Dehydration symptoms include, but are not limited to, urine is concentrated and more yellow, dry mouth and nose, dry skin, decreased tear production, headache, dizziness, sleepy or tired, and lightheaded, especially when standing. Severe dehydration symptoms can include, but are not limited to confusion, lack of sweating, little or no urination, weakness, coma, organ failure, ESP. Kidney changes in vital signs. Increase in pulse and decrease in blood pressure, and tenting of skin, sticks together, stays upright when pinched together. Your role if symptoms are noted. People who have symptoms of dehydration should see their healthcare professional as soon as possible or go to an emergency department for an evaluation. You should immediately notify your supervisor and follow your agency's documentation rules. Click on the next link to continue the training part 4.